If you're watching this episode during the month of February or listening to it, you may know that this month is National Cancer Awareness Prevention Month. And so it made me think that it's so important to get good information out into the public. And many people don't know what happens behind the scenes at fertility clinics. And it's so important to know these details because you need to advocate for yourself. So, what I've done is brought on a specialist to talk to you about it today. She will share with you all the things that you need to know, questions to ask, how to get support, how to get the right information, and how to block yourself from the noise and focus on what's most important. I hope this episode helps you, and please share it with anyone who may be able to benefit from it. Welcome to Building Your Family. This is a podcast about donor conception, surrogacy, fertility treatment, and all the ways the modern family is built. It's so nice to see you again today. My name is Lisa Schumann, and if you've been following me for a while, you know that I feel passionate about helping people have a better path to parenthood and a better parenting experience. And this week, I think it's really important that we talk about something that we're all thinking about this month, which is National Cancer Awareness Prevention Month. It's a mouthful, but it's really important for us all to think about this because although this podcast is not focused on cancer specifically, there is so much to talk about with regard to cancer and fertility, and it's really important that everyone gets the right information and gets the facts. As you know, I am a fan of the facts. And so to that end, I'm going to introduce you to somebody that I've known for a long time and I'm very fond of, Jennifer Gamper, who's been in this industry a very long time also, more than 2 decades too. And she is head of EVRMA Mental Health Services for North America. And it's an international organization and a wonderful fertility clinic. She has been there for a very long time and has worked very hard to expand their services for mental health and support for people going through all types of fertility treatment and to help the patients get through treatment in a better way. And today we're going to talk specifically about cancer treatment and what many of you don't know, what goes on behind the scenes. There's so much that goes on behind the scenes at a fertility clinic when you have a cancer diagnosis. And I thought it would be helpful to start there so you can get some insight into it. So thank you, Jennifer, for joining us. Really appreciate your time.
Thanks for having me. I think this is a really important topic you and I've talked about in the past, and I think it's really important that we talk about it this month. And I'm here for any questions and to support our patients in any way that we can.
That's great. So why don't we start there? Why don't we start with giving people, because you and I have both worked inside of fertility clinics for decades, and we have insight into things that I think that most people don't have insight into, how it works in the fertility clinic when somebody comes in with a cancer diagnosis. Can you share with us what that looks like?
So typically the patient will call, and in some cases, sometimes the doctors will reach out directly to one of the providers in the clinic saying, I have a patient here. This is what's going on. I really would like them to come in for a consult. And then we scramble behind the scenes to get that patient in as quick as possible. We know that when you get diagnosed with cancer and you hear that word, you are overwhelmed with emotions and feelings. And your priority is, how am I going to make it through this, right? What is this going to look like? And so our goal is really to have patients come in as soon as they can, to sit down with one of the doctors and to really understand what it means for them to go through treatment. Is it something that's feasible? Is it something that will affect their treatment in the future for their cancer diagnosis? So we really scramble to kind of do as much as we can from the get-go. So I always tell patients, as soon as they find out, to really start doing their research, asking friends, asking colleagues, asking their cancer provider who they would recommend coming to, and getting all of their records in hand, because I think that's really important that we have a copy of all of their records, what their diagnosis was, what the treatment plan might be, what their time frame is looking like. If they're going to have surgery within a week or two, what is that going to mean for us, right? And then we do all of the rest for them. We try not to allow them to worry about that. We scramble to kind of get all of the medications that they need. We work with their insurance to get coverage if they are going to have coverage, and we do all the other stuff behind the scenes for them to make sure that they feel supported by us. I think I
Yes.
always tell patients, as you're walking in the door there, it feels very overwhelming. But if you can come in with as much information that you can give to us, if you have scans, if you have any records, anything like that, bring all of that with you. And we make copies of it. And that way we have a better understanding. We'll also ask usually for them to give permission for us to talk directly to their providers, which is really helpful. A lot of times the doctors will pick up the phone and call their provider to really get the sort of understanding as to what the plan will be for them. And they really try to work together as a team to make sure that the patient gets what they need.
It's an incredible process because, as you know, most people who are watching this understand something about fertility treatment, and there's this, step by step process that everyone kind of goes along to retrieve eggs or to use a gestational carrier. But when you're in this process of cancer treatment, you need to take the fast lane. And so the clinic will automatically, a good clinic will put you in the fast lane, right?
Yeah, and I think it's overwhelming. I think, people get panicked when they hear about all the hormones, the injections they're going to have to take. We talked about this a little bit prior, saying
Hmm.
that, there's a lot of information out there that lets people panic, right? We do Dr. Google and we go online
Yes.
and we start to do our own research. And what we end up hearing is that, oh, I can't go on these hormones. This is going to make my cancer grow. Or if I go under anesthesia, that could affect me in some way. And so I always say to patients, get the information directly from the provider. Our inclination, as soon as we hear the word cancer, is to go on and try to get as much information as we can by ourselves. Right. And that information is patient by patient. It's patient centered, right? What somebody else is doing might be different than what I need to do. And so I think it's really important. I always say to patients, pump the brakes, take a deep breath, and actually sit down with your doctor and get the direct information that relates to you, your care, your case, versus reading all of the different stories online, right? It might not pertain to you. There are some cancers that they might be concerned about you taking the hormones, and others might not. Again, it's for a short, finite period of time. And so a lot of doctors are okay with patients going through it. They don't want them to necessarily do 8 cycles of IVF, but for them to do 1 or 2 in order to preserve their fertility before any further treatment. A lot of doctors are okay with that. So I always say, don't go on Dr. Google right away. Take a moment,
Hmm.
gather your information, gather all of the stuff that you need, and sit down with a doctor. Start making your list of questions as they're popping into your head. You know, as things about, oh, estrogen, is that going to increase my risks? What does this mean? What are the hormones? I always say to patients, you should walk into that doctor's appointment with all those questions and thoughts that have been racing through your head since you had the diagnosis, and get the information directly from the provider. And answering all of those questions can be really helpful. The other thing I always bring up is we talk a lot about how there's so many different fertility clinics. I think
Mm.
it's really important that the patient just not walk into any door, right? I think that it's really important that they do their due diligence in finding a clinic that is suitable to make sure that we are going to do what we need to do for them in the right way. And so I always tell patients, I know you're overwhelmed when you find out this information. And so asking, like, again, like I said, your provider, asking colleagues, asking friends, looking at SART data. SART is an organization that collects all of the data on a yearly basis from all of the different fertility clinics throughout the United States. And you can see the data. You can see how many cycles do they do a year? How many patients do they work with? What are their pregnancy rates for your particular age and things like that? I think it's really important that you pick a good clinic that's going to do this work after everything that you're going through to get to this point to have your eggs retrieved. It's important that you find a clinic that knows what they're doing.
Yes, 100%.
I don't know if you found that, but I've had patients that, you're in a panic when you hear this word that you have cancer, and you walk into any clinic nearby or any local clinic, or you see an ad somewhere and you walk into any place. And I say, before you do that, again, pump the brakes, take a moment and find a clinic that's legitimate, that's going to do what they need to do to help you.
Yes, 100%. And I think just to kind of backtrack on what you said first, I really want to highlight for everyone, it is so, so essential to listen to what Jennifer's saying about talking to your doctor. It's so true. We see this all the time, right? We see patients who come in at 55 and say to their doctor, my best friend had a baby with her own eggs and she's also my age. And so why can't I? Well, we don't know what her situation is. Maybe she did, maybe she didn't. Maybe there's something we don't know. Maybe she froze eggs younger. You just don't know all the details. And you can't fill Dr. Google with enough information to get the nuanced information that you would really need to ask the right questions. So I think it's so important what Jennifer's saying to make sure, even if you just need to make an extra appointment with your doctor, and sit down, as she's saying, and ask those questions. It's so valuable because then your information will pertain to you and not to, everybody on social media. And what she's saying about SART is so important too, because you want a good fertility clinic and you want a good lab. And I think that that also is true with all different types of treatment. We see that there's lots of different types of treatment. We don't know what sort of treatment that person may need down the line if they freeze their eggs or their sperm. So, how do people think about that coming in? I know you have some really helpful ideas about how to kind of preemptively say, okay, these are the things I need to think about with my future, and I need to be responsible for myself, make sure my doctor understands that I could end up in any type of treatment.
Yeah, so I think we were talking a little bit earlier about there is certain requirements for the federal government, FDA, right? And so if a patient comes in and let's say they're going through treatment and they know they're going to have to be on long-term therapy,
Mhm.
so they might be able to freeze their eggs, create embryos if they're in a relationship or with a partner. And then in the future, they might need something like a gestational carrier in order to carry a pregnancy. The FDA guides us into requirements and certain things that we have to do. And so when you go in to retrieve your eggs, it's really important to understand what those guidelines might be. You might not know that you're definitely going to need a carrier, but if that is something that the doctor might have mentioned to you or at some point might be something you have to think about, we encourage you to do FDA testing. So, FDA is an extra blood test that they do. They test for certain things. It allows the embryos to become what we call FDA eligible, right? And so in the future, we can transfer them into a carrier's uterus to be carried. If you're rushing through the process and that doesn't happen, those embryos might be deemed ineligible. And there are certain
Mm.
waivers and things that sometimes can happen, but sometimes it can't happen. And so we really want patients to come in and look at the bigger picture. Even if they don't envision themselves using a carrier in the future, that's okay. They don't need to make those decisions today. But I always say it's important to have those dialogues and conversations with their doctors or nurse that they're working with at the office or even their mental health provider to get a better understanding of what things might look like. We want them to think of all their options as best they can so that in the future, whether that's a year, 6 months, 2 years, 3 years down the road, they're not regretting this decision, that they didn't think through everything, right? I always say to
Mhm.
patients, you don't have to make any decisions now. It might just be that you're going to create these embryos. If you're male who's going through, cancer treatment as well, it might just be, I just need to freeze my sperm and then the rest of it I'll think in the future. But even for men, as they freeze sperm, they have to do FDA testing as well. And so that, again, we might not know what the future is going to look like for how I'm going to have a family, but at least thinking ahead of that and doing all of that stuff and kind of checking all of those boxes will make life a little easier for them in the future when they do decide which route they want to go. And once again, talking about good clinics, if you go to a good clinic that works with patients that has been in these situations, they will do their due diligence to check all those boxes and make sure everything's done so that you do have all those options in the future for what you might need.
Mm. Yes, you don't want to be stuck in a situation where you don't have options later.
Yeah, and it's hard to know, right? Where again, when you hear this diagnosis of cancer, you're in survival mode. You're trying to figure out how am
Yes.
I going to survive? What do I need to do? For a lot of patients, they're not even thinking about their fertility treatment, or maybe they already have a child, and maybe they're not thinking that they want another one. And so, I also encourage patients to even just come in and have the consult. Just because you walked in the door does not mean you're signing up to do IVF or signing up for surrogacy or signing up to do an egg
Mhm.
donor or anything like that. What it means is that I'm coming to educate myself to understand what I need to consider, right? There are some offices will have mental health providers on staff. Some of them can give a wonderful list of outside referrals. I refer people to you.
Mhm.
Finding somebody that you can sit down and after you get all this information from the doctor, talking through your options and sort of educating yourself. I think it's all about education. I always say to patients,
Mhm.
you might walk out of that office and say, you know what, I have 2 kids already and I feel like my family is complete. Or maybe I never envisioned having a family. And now all of a sudden the doctor's throwing all this information at me. I'm feeling totally overwhelmed. I always say educate yourself, meet with providers, meet with people that work in the field, learn about these different steps. You might choose not to move forward. It might feel like it's not important to you now, and that's okay. But at least you did your due diligence to kind of understand what the process might mean for you.
And how can people find people with doctors and mental health providers who can give them the right information? Because as you know, there are so many people out there kind of selling snake oil or who have beautiful websites or say they do certain things and we don't really know. And so patients are so vulnerable and, as you said, really stressed at this moment. And we want to make sure that they're just not getting a referral to their, best friend's daughter who, opened a practice yesterday. So how can patients really protect themselves and make sure that they have providers who are going to give them accurate information?
So, what I do, I always say there's a few organizations out there that they can do some research with. First, whatever organization that, like whatever type of cancer they might have, there is usually an organization that work with those types of patients, right? So, I always say start there and start to do your research. I always go to the primary doctor that they're meeting with, whether that's the cancer specialist that they've been seeing, whether it's a gynecologist, oncologist that they're maybe seeing and working with. And I always go to those people
Mhm.
first, right? Because a lot of these oncologists have doctors that they have a good rapport with, that they trust, that they know, that are from these large organizations that will work with them. So I always start
Mhm.
there. Second, I would go to an organization like an ACOG, right? That OBGYN might have some information. Maybe ASRM, American Society for Reproductive Medicine, has a lot of data and information. SART, SART, like I said, is our data collecting organization that collects all of our statistics and things like that.
Mhm.
Other good organizations, Resolve.org
Yeah.
is a great organization that advocates for patients going through fertility treatment. Resolve has a lot of mental health providers listed that can help guide them. Also, some organizations like Resolve might be able to get them in touch with foundations, different grants that might pay for some of this treatment for them.
Yes.
That's the other piece is like so many patients are in panic mode because they're like, how am I going to afford to do IVF? I hear IVF so expensive. Using a carrier, forget about it. I don't know if I'll ever be able to afford that. There are different foundations and organizations that can help and sometimes provide some care if their insurance isn't going to pay for it. I'm finding a lot of insurance companies will pay for fertility preservation depending on their diagnoses. But
Mm.
that being said, I think there's other organizations that can help. So I think, yes, asking your friend, that's great. She might have a resource,
Mhm.
but going on someone's website, reading reviews, going to ASRM, going to Resolve, looking and seeing what other people are saying or doing, right? Not going to your local mom and pop shop, but doing your data collection on the bigger agencies and the bigger organizations can be really helpful. When you
That's
walk in the
great.
door, you might meet with a doctor and they just might not feel like a good fit for you, right? How many times have we gone to see a doctor or as therapists, you go to see a therapist and maybe you just don't feel like they're connecting with you? Again,
Mhm.
just because you walk in the door with that particular doctor, sometimes I've had patients that leave and go for a second opinion to another clinic, right? They want to take all the data from those two appointments that they have and see what might be the best course of treatment for themselves. Same when you're diagnosed with cancer. A lot of people go for a second opinion or speak to a specialist or somebody else in the field,
Mhm.
right? And so I say the same thing when it comes to your reproductive health and your reproductive journey. Sometimes you might want a second opinion. You want to hear what people are saying. Is this the right course of action for me? I always say don't be
Mhm.
afraid to ask questions. I think it's really important. Like I said, have that pad of paper with all your questions written out and make sure you check those boxes as you're going through your consult with them. Make sure those questions are being answered. If you don't feel like they are, maybe this isn't the doctor or the practice for you. Maybe you want to go to another practice to hear what they have to say before you make the final choice.
That's a great idea to if you get a second opinion and then you can compare answers and see if it's accurate, right? You might go to some guy down the street and say, they said X, Y, and Z, and then the other doctor will say, well, this is why this isn't the case. So that's great, great information, Jennifer. I mean, I think that's so helpful for people to really understand.
I think there's a lot of different blogs out there, different support groups that are popping up, which is amazing that we have access to these types of things now on the internet, right? There's so many positives and wonderfuls with all of that. But at the same time, you're hearing things that might not pertain to your care, right? Or you're seeing
Mm.
things or reading things. And so, back to that again is to bring that information back to the provider, the doctor, and asking about those different treatments. Or I read this, or somebody I met in my group who has the same type of cancer as me is going through this. Have you heard of it? I always tell
Mm.
patients to bring those questions directly to the practice. And when you're working with a large fertility clinic, a lot of them have research on some of these things, right? Collect the data, can reach out to their other colleagues if maybe they don't have the data on that and get it. Speak directly to your doctor, right? And so I think bring those questions versus just doing your own due diligence on the internet and on a blog or on some support group and ask those questions
Mhm.
directly to your providers.
Yeah, that's so important, and it's almost like we have to kind of train ourselves to do that because it's not natural, right? We're always just kind of scouring the internet for all the information, but it's really helpful to stop and take it to your doctor.
Yeah, absolutely. I think as you go through this process, you're so overwhelmed. like I said in the beginning, when you hear the word cancer and you hear that you have this diagnosis, we immediately go to a dark place, right? And then it's kind of picking ourselves back up and saying, okay, what's the plan of action? How am I going to proceed? What is that going to look like? And so I think it's daunting to even think now I'm going to add this extra piece to it. Now
Yes.
I'm going to do this fertility preservation and I'm going to have to go through maybe injections and hormones to retrieve my eggs and do all of that. That can be overwhelming. That's why I always say there's people like you and I in the field that understand the process of the IVF and the hormones and the injections that can offer that support, can be those people that can kind of hold it together and help them figure out their next steps and guide them through the process. I know a lot of our patients that come in have already been assigned either a social worker or some type of support group or something within the cancer community.
Yes.
We're like an extra additional person. I always say, reach out to us because we understand what it means to have to do an IVF cycle. What are these numbers? What is all of this going to look like? How am I going to get through this? What's going to happen here? And so we're there to sort of support patients. There's a lot of us in the field that have been here for a long time and have heard all sorts of stories,
Hmm.
and have a lot of really good resources that we can help provide to patients. And so I always say now's the time to reach out for the additional support that you can versus, the AI that creates, you type in your,
Hmm.
your message into Google and it creates something, right? Go
Right.
for the actual human contact.
Yes.
Let us be there for you. Let us support you through this because it is a very overwhelming and daunting journey on the best of days. Aside from hearing the big C word, right? It's a lot to process and think about. And when you're, in this rush, you walk in the door and then a couple days later, now all of a sudden you're starting hormone treatment to go
Yeah.
through an IVF retrieval. It's
It's
daunting.
overwhelming. Hmm.
Yeah, it's very overwhelming.
Yes, absolutely. And it's so important for those of you who are thinking about this to really listen to this advice because it is natural to say, okay, well, my cancer doctor is going to take care of all this and I've got support groups. But the fertility clinics do have access to mental health professionals like Jennifer who can help you through this piece of treatment. And also, as she said, understand this whole process in a way that maybe other people don't. And it's so important to access that support as you're going through this because it is so difficult and so overwhelming.
I also think, and I don't know if you found this, I think that a lot of patients know that they have cancer, they have a treatment plan for the cancer and what they're going to have to go through and surgeries and so forth. But sometimes during that piece, they want to plan for the future. Like they want to start thinking about, okay, if I'm told that I'm probably going to need a gestational carrier because I have to have a hysterectomy. They might not be signing on the dotted line to do that, but being able to have the conversation and discussion for what that might look like. I've
Yes.
had patients say that gives me like a sense of hope, right? That gives me something to look
Mhm.
forward to. I know the journey can take a really long time. So, can we meet to just talk about my options? I mean, I went through this crazy cycle. I did my IVF. Now I'm doing my cancer treatment, but I need something else to focus on. I need something else to feel like, okay, there's hope. I'm going to have that family that I had always dreamed of. This is just a blip in the road, right?
Mhm.
And so I think that can be helpful, kind of having a plan in the future. Maybe again, not exactly what's going to happen, but to start to be able to process my options and feel like there is something else out there for me at some point.
Yes, that's great. And that's also another great use of having the mental health professional from the fertility clinic to guide you and give you a roadmap like that. And I think that's such great advice. Patients really need hope and also need to feel more control in their lives, right? Infertility treatment makes you feel out of control. Certainly, cancer is going to make you feel out of control. But here you can start to kind of map up even if it's in pencil, what your road might look like. So that's wonderful advice.
Yeah, for us that work in the field, we know how long it takes. We know it takes a long time to be matched with a carer. We know all of these
Mm,
things, right? But for other patients, they think, okay, when I'm done, then I'll go through this process. It'll take me a month and then I'll be able to get pregnant or I'll be able to use a carrier and the journey's longer than that. And so I
mhm.
always say to patients, start the conversation, start meeting with someone, just start talking about your options. It allows you also to mourn the loss and the grief that you're experiencing of this is not the journey that any of us thought we would be on. Right.
Right.
I didn't think I was going to have cancer and then have to let go of, the idea of not being able to carry a pregnancy and then wrap my head around the fact that I'm going to entrust someone else to do that or whatever that might look like, right? Or I
Right.
thought I would get naturally pregnant. I didn't think I would have to go through egg retrievals and do all of this. And so I think, allowing yourself the time to talk about it allows you to also grieve that, right? And process that
Yes.
information. It is really hard to when we get to that fork in the road and it's not how we envisioned, right? To let go of that. And what is that going to look like for me? And then what are my options? And I'm sad. And this is not the journey I thought I'd be on, right?
And you're dealing with the fertility and cancer at the same time, which just one of those alone is overwhelming.
Yeah.
So,
And it's hard, not many, you might find a group of friends that have been through similar things too, but the majority of patients who are diagnosed are not going to have a friend or a best friend or a sister or sibling that has gone through the exact same thing as them. And so
right.
I think sometimes it can be really helpful to have conversations with people that can relate. So again, letting us help you find a support group, letting us have conversations with you about options, meeting those other families who've used gestational carriers because they found out they had cancer and they're out the other side. And that gives me
Mhm.
hope to be able to talk to somebody who's been through this process. I think that, fertility clinics can be a huge resource for patients. But again, when you walk in the door, you're just in survival mode. You're just trying to check the boxes. I always say to patients, that's okay. Do your egg retrieval. And if it's in a month or two and you need to reach back out to us at that point, because now you feel like you're in a different place, that's okay. Then reach back out.
Yes.
Majority of large clinics can give you resources, give you referrals, give you names of people, help you find support groups and all of that to help you process all of this.
Yes, right. The door's not closed. So once you leave your treatment, you can still kind of go back. If you need to lick your wounds first, but come back and get that support, get that guidance, get your roadmap sorted out, and you'll feel so much better. It's so
Yeah.
true.
And learn your options, right? Like, I also
Mhm,
think
mhm,
if you go into an egg retrieval and it's not as good as you expected, right? There's always other options to talk about. You might not be at that point to talk about them. For example, egg
mhm,
donation, sperm donation, other options. But know that there's always places like clinics that you can go back in and talk to about a couple months later after you've sort of gone through the treatment or been out the other side. There's always other options to talk about. And I think that's important. Sometimes we're not ready to hear those things in the beginning. Like I said, you're in survival mode, you're just trying to check the box, do
get
this.
through it.
You're not ready to hear about that stuff. And that's okay. Sometimes we need to hear things 2, 3 times in life in general
Yes,
for it to sink in, right? How many times has somebody said something to you and then finally on the 3rd time you're like, "All right, maybe I'll try that." And I think it's the same thing, as fertility journeys happen, sometimes you need to hear things happen a few times in order to for it to settle and sink in that that might be an option that you had never imagined.
it's so true. That is absolutely so true. Imagine your beautiful future. You're snuggling with your child. You feel so connected to them. Your friends and family are so happy, and you have everything that you've ever wanted. I want this for you too, but I want more than that. I want you to feel secure knowing that you've made the best decisions, not just short term, but long term for your future family. Wherever you are on your journey, whether you're choosing a donor, choosing a clinic, learning how to talk to your donor conceived child about their origins, all of these decisions will have wider implications for your future. And I want you to have the right resources so you can feel empowered and confident at this very important time in your life. That's why I'm so excited to introduce you to Building Your Family. It's the only expert guided platform designed for parents and parents to be using reproductive medicine. We provide unique strategies that you won't find anywhere else to make your path to parenthood smoother and more informed. And that's why our approach is about offering practical and actionable steps that you can use right now. Whether you're just starting out or already deep into your process, Building Your Family is here to guide you with expert advice, specialized education, stress reduction strategies, and a community to support you every step of the way. We can't wait to see you inside. If you don't mind us kind of talking about this for a moment, Jennifer, I think it's good for the audience to also understand that you have had personal experience with this, with that feeling like, oh my God, that shock of the diagnosis is just so horrible. And you can understand that feeling of feeling paralyzed and scared and all of that. Do you mind sharing a little bit of your story with us?
Sure. Yeah. A year ago, I was diagnosed with breast cancer, went in for my annual mammogram, which I tell every patient to go for, right? Had a family history. My mom years ago had breast cancer, but it, didn't go anywhere. She didn't need radiation. She had a lumpectomy, really wasn't a big deal. So I always thought, okay, I'll just go get checked. Never felt anything, went in for my annual mammogram and found out that I had breast cancer and was going to need a mastectomy, at least on the one side. Chose to do a bilateral mastectomy. But I remember in that moment, like finding out you have cancer, the phone call. I think I was away for the summer with my kids. I get the phone call and they say you have cancer. And I'm like, wait, what? Not thinking that was ever possible. And you're in that
Mm.
survival mode. When can you get in? When can you get it out? What are my options? Not thinking anything through. While I didn't experience infertility at the time, that cancer diagnosis, I think, is overwhelming. And so I can
Yes.
appreciate where patients are coming from, where you're in this survival mode. It's like, I have cancer. The first thing you think of is, I just need to get it out of me, right? This thing is growing. And the longer I put it off, could it be growing? Could it be multiplying? Is it going to spread somewhere? And so that panic. And so what I did was obviously take a moment, called a therapist that I know and said, you got to talk me through this. Like, tell me to, like, calm down, do some deep breathing. As a therapist myself, I thought okay, who do I call? I call another therapist, right? You
Yes.
need to talk me
Hmm.
down. And then sort of laying out a plan of action was really helpful for me. Okay, so you're going to call this, you're going to go to this person. I already knew who the doctors were, being that I work in the medical field, of who I wanted to go to, but it just helped me kind of take pause to kind of sit down and say, okay, this is going to be the plan. And every appointment that I went in, I made sure that I had my list of questions. And I had either a friend there, I had my brother on the phone, my husband, somebody else with me on the phone, so that I could make sure that I was hearing what I was hearing. And how many times we walk out and we heard one thing, but that's not really what they said. We heard what we
Right.
wanted to hear.
Yes.
And so the one piece of advice I always say to patients is to share with somebody what you're going through, whether it's a partner, a best friend, a sibling, a colleague, somebody that you can trust that can make it to those
Hmm.
appointments with you, I think is really important. Same when it comes to, if they say preserve your fertility, have a friend on speakerphone if they can't come. Have somebody there for you to understand and listen and take notes for you with all of those appointments. I think
Yes.
that is the one thing I was so appreciative of, is that I had all of these resources of people that also worked in medicine that could say, did you ask this? Make sure you ask this. This is what you wanted to know. Get a copy of this, because you're like a deer in headlights. That's how I describe it.
Totally.
Walking into those appointments, you're like, you don't know what you're doing and you're feeling overwhelmed. And so always make sure you have somebody there with you. And again, it's hard. I know people's lives are busy. You feel you don't want to bother somebody to come to drive to that appointment with you. In the way of the world with FaceTime and speakerphone, I mean, a lot of doctors won't let you record what they're saying or record an ultrasound or a scan, but they'll let you be on speakerphone. And so you have one of your friends on speakerphone taking notes.
Hmm.
Those
That's
types of
so
things. I think
important.
I think that's the biggest piece of advice I can give is get your support people in place, and might be just one person, but we all need that. And that was the biggest thing I learned, is that, like, people want to help, like my
Yes,
friends
they
wanted
want.
to jump in and offer support and do things for me. And so I think that's
Hmm.
really helpful, is to ask for help from people.
And to have that help, assistance, but also to have the professional guidance. So, because best friends always want to help and sometimes they want to fix things and it's not always the right way of fixing it.
Mhm.
So, it's good to have both, right? To have your kind of team in place so that you know what the right guidance is. And then you also have someone to kind of help you dry the tears and help you focus on what you need to focus because it is so overwhelming.
It's a lot to think about. And I think you're right. People try to fix things. So what I would do is
Mm.
make a list of exactly what you need. I always say that to
Hmm.
patients, like, no, I don't need you to, try to fix it. What I need from you is, could you make me some homemade soup? Could you come over
Hmm.
and vacuum for me? Give people tasks that makes people feel good. Or could you go to the store? This is what I need from the store. I need, new dressings or bandages or something, or I need this help, because people like tasks being assigned to
Yes.
them. And yeah, so maybe it's not the friend that's trying to fix it and tell you everything's going to be better. And in your head, you're thinking, okay, it might not be, but it would be really helpful if I didn't have to cook for the next 2 days, I always say, or it'd be
Hmm.
really
Hmm.
helpful if, yeah, I didn't have to vacuum, or, I didn't have to take the dog out for a walk. Could you come take the dog out for me? So figure out what it is you need. I always say to patients, what do you need in this moment, right? Like, what is going to be the most helpful for you? What do you not need? I have some patients that walk in the door and feel very overwhelmed, and the doctor going through the details of every single step is daunting to them.
Hmm.
It might be the person that are like, I just need the basics. I know I'm going to do IVF. I know
Right.
I'm going to do all of this. I know I'm going to do it. I just need you to tell me each day what I need to do, and I'll do it. Whereas
Right.
other patients need a lot of detail. They need why you're doing this, how you're going to do it, what are the hormones going to do to my body, in the details. So the other piece of advice I always say to patients is to tell your provider what it is that you need. I might not need details. Like, I went and I remember when I was going into surgery, like, I didn't want to know exactly how the surgery was going to happen. Like, I didn't need to know those details. I just needed to know you were going to put me under anesthesia, how long it was going to take, and what it was going to be like when I came out. Where I've had
Hmm.
friends who also had breast cancer, because once you're part of this club, all of a sudden you start meeting all sorts of people,
Yes.
right? And they needed to know every detail of every single thing that was going to happen, exactly what the procedure was going to look like, exactly each step of the surgery. So that was not me. So I always say to patients, what is it that you need? Do you need details? Do you not need details? Do you need the entire big picture? You just need this little step along the way, what each week is going to look like.
Hmm.
Figuring that out can be helpful, I think.
Yes, very helpful. And as you said, communicating that to people because people like to give unsolicited advice and that's not always welcome. And then all of a sudden you find yourself kind of pushing yourself away from your friends or your mother-in-law or who could be bringing you soup instead.
Mhm.
So I think that's great advice, Jen.
Going through cancer treatment, going through reproductive treatment is a really personal, intimate thing. I happen to be an open book. I happen to be somebody that posted to social media because I work in the field. I felt like it was so important for women's health for me to share my story and to offer support to others. But for everybody, they don't feel comfortable with that.
Right.
And so I think, you got to know what you need and who those select people might be. Maybe you're not posting every step of the way in your cancer treatment. Maybe you are. Figuring out, again, your needs, I think, are really important because some people are not so comfortable sharing it with a lot of people.
And to make them known, right, to your partner, whoever's in your life.
Exactly. Exactly. I also think, we were talking about cancer in very general terms. And so I think that, I went through an experience with breast cancer, but there's so many different types of cancers with so many different treatments, with so many different
Yes,
plans for patients. And so I always say we don't all fit into the same box too. And I think it's really important that you get the support that you need for whatever particular experience you're having. Every experience is different for everybody, and every journey from that particular cancer is different. I had a really easy journey. I felt like my surgeries went really well. I didn't need radiation and chemo. I was super lucky that they caught it early on. And because I chose to have a bilateral mastectomy, I didn't need to have all of that. But I have other people that went through breast cancer that had a very different journey, and chemo and all of that. I think it's important to also be where you're at. Your journey might be very different than someone else's. And so to, again, get the support that you need specifically to what your needs are.
exactly. I think that's so well said. And I think that's a good place for us to wind down. But before we go, is there anything else that we haven't covered that you think would be helpful for the audience to know?
I think, we talk so much about women today, right? Because that seems to be a lot of our patients. But I think there are a lot of men going through cancer as well and need of cancer
Yes.
treatment and need to talk to a urologist. Again, there's a lot of support for men out there as well. They might not be going through the IVF and the egg retrieval process, but the freezing of the sperm or what that might look like in the future. There's also great resources for that as well. A
Yes.
lot of those men might come to a fertility clinic to freeze. Some of them might not. They might go to a local sperm bank in order to do
Hmm.
that. But also know that there's resources like us at fertility clinics that can also reach out and offer support for men as well, and what that might look like for them in the future and their options as well.
Yes. And the same rules apply, as you said previously. If there's some concern about maybe needing a gestational carrier in the future, or we don't know what your future is going to look like, check with the fertility clinic rather than just freezing sperm anywhere. If this is going to be a situation for you where you might not be able to get sperm in the future, you really want to be thoughtful about it.
Correct. And some of the sperm banks, the larger sperm banks, are aware of those things
Hmm.
with FDA and stuff like that. But that should certainly be a question that they ask. And they can always call and speak to a nurse or a provider at a fertility clinic to see if there's any additional tests that they should have done prior to.
It's great advice.
Yeah.
It's great information, Jennifer. Thank you so much. Really appreciate your time and all of these wonderful pieces of advice. I think it's so important that we share this. Where can people find you if people have questions for you?
So they can send me an email directly if they want. I'll give my email. It's jgamper, Gamper, at ivirma.com. I also have a private practice, JGM Counseling, and you can go to my website there and shoot me an email through that as well. But yeah, we're here for you at any time. If you have questions, concerns, I always say to patients, we have clinics throughout the United States. And so I'm based in New Jersey, but we have resources throughout for you. So please do not hesitate to reach out and we can point you in the right direction for any support that you might need or clinic advice or anything like that.
That's great. That's great. Well, thank you so much. And all of you out there, I hope you found this really helpful. I certainly did. I think it's really useful to kind of look at this information and think through all of the things that were mentioned here because you really don't want to miss a step. It's so important that you take care of yourself the best you can. As we always feel, it's important to have the best journey you can, and the resources are here, obviously. So thank you so much for joining. And before you close, please press subscribe because that's how we keep going. And I will see you next week.